The following program is a public access production. Comcast is required to provide time on this channel and make it available pursuant to franchise agreements with the communities we serve. Comcast is not affiliated with the following program or the producers of public access programming and is not responsible for the content. The following program does not reflect the opinions of Comcast or its affiliates.
And welcome to our show today. Today we're going to be talking about health and glamour. We're going to talk about how you can become healthy and glamorize yourself in a variety of different ways. So stay with us. We're going to be talking with the doctor from the Advanced Vein Treatment and Cosmetic Center, which now has offices in many, many locations. And I'd like to introduce you to him. This is Dr. Safvi. Dr. Safvi, thank you very much for joining us.
Thank you, Karen.
I'd like you to tell people, first of all, what your background is.
My background is I'm an interventional radiologist. I do a lot of sophisticated procedures in the hospital setting, including stenting, angioplasties, and other sophisticated things that sick patients need. But I also had an interest that I developed into doing vein treatments and cosmetics. The skills from the hospital led into the vein treatments, which I do almost full-time now.
Now, interventional radiology, I don't know how long it's been around. A lot of people didn't hear about it until just recent years, right?
Interventional radiology has been around, that's true. We're called doctors because we deal with a lot of procedures that are done in the angio lab, dealing with the patients that are pretty sick. But also one of the procedures, like I said, was the vein treatments that branched off of interventional radiologists. We developed this procedure, and now it's widespread, and it's one of the procedures that is one of the armamentariums that we have.
Well, varicose veins not only are unsightly, but as I understand it from talking to you before, and because Alice here has been one of your patients,
right.
And she feels like she's 19 again after you did the procedure. She said it cured a lot of her problems. But it's not only unsightly, but it's unhealthy, right?
That's absolutely true. This is a medical disease. It's more than just cosmetics. If you have varicose veins, it can be a real problem for you because it produces pain in the legs, especially towards the end of the day. With fatigue and tiredness, you have to deal with this pain towards the end of the day, and most of the day, if you're standing up, it makes it worse. And unfortunately, it's passed on from parents to children, and there's a strong familiar history with this disease. But it is definitely a medical disease, and it's treatable.
So it's not necessarily caused from sitting all the time?
No, unfortunately not. I mean, there's not much you can do to prevent it. A lot of people who are in their 20s can develop very severe disease as well. So it's something, unfortunately, you have to deal with, but you don't have to live with it. You can get it treated.
Can you explain to us exactly what happens when you have that type of vein disease?
Yes. The vein disease that I'm talking about are the big ropey type veins that are present in the lower legs. They become large bulging veins. They're called varicose veins, and the underlying fundamental problem is the larger veins in the thigh. They become defective. There's typically one-way valves that are present in the veins that direct the blood flow up towards your heart, and those valves become defective.
Leave this down here.
And in treating those valves, we have to close that vein, and it's very treatable now. We can treat it with a small laser procedure in the office setting, and the results are wonderful.
Now, can people come in just for consultations if they think that they have this problem? Or they know they have it, I guess. A lot of people try to hide it.
Yeah, absolutely, yeah. Unfortunately, a lot of physicians who don't specialize in vein disease don't know what is out there. Even the physicians are not aware of what the treatment options are. Of course, you can come in anytime to our center or multiple locations that we have for a consultation. It is complimentary, and we will assess and do an ultrasound of the legs to see where the underlying problem is.
It's very interesting. You know, I had that done, not because I have the vein problem, but because one day I felt that maybe I could have had a clot or something. I felt a pain in there, so the ladies in your office were kind enough to do that. It's very interesting because they actually massage it up and they check the flow in your legs and everything.
Right. The exam is done in an upright standing position. It's trying to simulate your walking, and we can tell where the problem is typically with that exam.
So is there any prerequisite then that patients need to do for a certain amount of time before they have surgery? I mean, do they have to wear stockings? Do they have to do anything, or can they just have this taken care of?
They can just have it getting taken care of. Previously, the insurance companies were requiring to have trials of stockings, which after research, and they found out that's not really the case, because you really need to get it treated, because if you don't do anything, it won't improve on its own. Unfortunately, it keeps getting worse, and eventually the end point is skin breakdown and ulceration by the ankles if you let it go far enough. In the early form is this little tiny spider veins, which are also injectable, and we treat those as well as the later end stage of the disease.
And then what do you have to do afterwards? You have to walk a certain amount, or what do you have to do?
Afterwards, after the treatment, which is a 1-hour office treatment, you come in and you get the treatment, which is very easy, very tolerable. A few needle sticks in your leg, and that's all. No cutting is required. No stitches are required. After the treatment, you just get off the table, you put on a stocking, and you just walk home. Actually, you're suggested to walk 30 minutes that same day and every day for the next week.
Is there any pain medication that's given with it, or is it not painful at all?
Oftentimes I don't give any pain medication to patients. The majority of my patients don't need any pain medications. It's very tolerable.
So, and this could be at any age. I mean, at what age is the youngest patient, and what age is the oldest patient?
Yeah, like I said before, I had a patient in their early 20s, just a 21, 22-year-old with large bulging veins, to anybody in their 70s to 80s that I've treated. And at any age, if you have that problem, it's very fixable.
Now, where are your offices located now?
We have offices in Palos Heights in the southern suburbs, further south in Olympia Fields, also further north in Lombard, and up farther north in Algonquin.
So you cover the whole area?
Yeah, we cover a large area.
I know, because you used to have one in Oaklawn, but you moved that to Palos, right?
Right, Palos is our main location. That number, if you call that office, it'll connect you to the rest of the offices.
Okay, now you were willing to send anybody a free brochure if they want it, right? So they could call this 866 number for a free brochure?
Absolutely. Anytime you need any information, you can call this number for information, including a free brochure.
It's an easy one to remember. It's 866-325-VEIN, V-E-I-N. Palos Heights, Olympia Fields, Lombard, and Algonquin, or you can always email me at asktvnurse@yahoo.com for further information on this. But now you've branched into many other things, and I want to talk something about that. First of all, besides, you do liposuction also, right?
That's correct. We do liposuction in the office. While you're awake, we do laser lipolysis, which is a very nice procedure to take care of any areas in your body that are a little bit larger than what you would like.
Okay, so is that the thing where they put the machine over it and then the lymph takes it out of your system?
Yeah, that's a different procedure, actually. This is actually liposuction. We actually make a little tiny incisions about 5 millimeters in size and put in some numbing medicine in the area that we're going to treat. Then we take either an ultrasonic probe or a laser fiber to melt the fat. After we melt the fat, we suck it out with a little suction cannula. So this is all done while you're awake. It's very painless in the sense that you don't feel anything. You're awake, you're talking, you're not feeling much. It's all numb, and the recovery is very fast. You wear a compression garment afterwards, and then you walk out of the office. It's not like traditional liposuction where you have to be under general anesthesia to undergo a large amount of
How much fat can you take out at one time?
We can take out a large amount. I've had patients that have taken up to 4 liters out.
How does that relate to pounds? Or does it, or inches? Or
It's several inches. It's several inches, and pounds, it could be several pounds, but we don't measure the pounds. We shape the body to take the, the shape that the patient desires.
Well, I did see one of your patients who had that done, and she told me that there was no pain, and she was thrilled because she had a waist again.
That's correct, yeah. I mean, you don't have to be terribly overweight, or you don't have to be, having a large amount of material to remove. But you can be slim, and it's very hard to get rid of the areas even after exercising. So those areas are very treatable.
So where do you go from, do you do the chin too, or do you do just the body?
No, we actually can take the liposuction technique to most places in the body, anywhere from the chin. Definitely chin is a big area that we treat. And to the arms, we can treat the arms, mostly in women. The back, and of course the upper and lower abdomen, flanks in other areas, inner and outer thighs, as well as even the calves. Sometimes people have asked me to remove some.
So now with this, you wouldn't have the big scar on the arms that they talked about before, that they worried about. Often women talked about having that done, and then they were afraid that they would have a long scar. Now you just have a tiny.
That's correct. Yeah, this is body sculpting, body shaping, so it's very, very tolerable, and the incisions are only 5 millimeters. So there's really not much scarring at all. The only incision that you would have is that 5 millimeter incision at certain strategic positions where we need to put the cannulas in.
And there's no pain.
Just a needle stick when we numb you.
Discomfort?
Yeah, not much discomfort. No, it's very tolerable. You're awake, you're talking, you can watch TV or a movie if you like.
How long does it take?
It can take, it depends on how much areas is involved, how much we have to take out. It can be anywhere from an hour to 2 hours.
Are there any adverse reactions to this?
To liposuction, just the recovery time. I mean, you have to wear a tight garment so to keep that shape and keep the swelling down.
And how long is that?
Recovery time with that garment is about 4 to 6 weeks.
But you can take showers and everything.
Yes,
no problem
it's
with
just
that,
like
right?
a piece of clothing. You wear it under your clothes.
Very interesting. Okay, laser treatments.
Yeah, we also do laser treatments. We have a top-of-the-line laser at our offices. We do many things with that laser. This laser includes, first of all, laser hair removal. We also do photofacials.
Is that both dark and light hair? Because I've heard people ask about that.
Yeah, we have lasers for both skin types, and it's very safe. In the wrong hands, it can, of course, cause some problems, but our staff is very well qualified to treat all skin types. We also do the photofacials with the lasers. This laser contains multiple wavelengths, and multiple lasers are built into that machine. Photofacials are for skin damage, or sun damage.
For sun damage?
For sun damage on the face, chest, arms, any brown spots.
What does it actually do to it?
The laser affects and interacts with the pigment in the skin. You do a specific wavelength targeting the specific target, which would be the brown spots in the skin. And you target that brown spot, and the brown spot would eventually will flake off of the skin over several days.
Is that like photorejuvenation?
Exactly.
What they call? Okay.
It's photorejuvenation / photofacial for any age.
Does it tighten the skin too, or not?
There's not that specific procedure, but there's another specific wavelength for skin tightening. We also have that procedure called Skin Tight, which is a specific wavelength to promote collagen growth anywhere you'd like, anywhere you have loose skin, wrinkles. It tightens your skin by promoting collagen growth by the specific wavelength.
Now, I heard somebody say that a doctor told them that their tendons were looser than they should have been from sun damage or something. Will that help a situation like that? I mean, it's still tighten the skin over it, right?
The tendons, tendons will not be affected by the laser because it's affecting the skin mostly, and it can't penetrate that far deep to affect the tendons.
But it still would tighten the skin over it.
Yes, yeah. I mean, if you have skin loose or some laxity, that can fix that. Yeah.
So what am I missing here now with the injectables? This is the injectable, right?
Yeah, we also do the injectables.
You want to open that up
sure.
and show us?
This is a specific, in this brand as Radius, but we have multiple brands of injectables. Basically, injectables are used to fill in the nasolabial folds, which are lines over here, marionette lines, which are over here, or anywhere, number 11 lines. Some people get lines here. Sometimes people lose skin or fat under the eyelids, which is the tear trough as you age. So these fillers are put in there to
But now
give
they
you
used
back
to
some
say that
volume.
this was fatty pads and that they'd suction it
Yeah.
up, but when it's sunken in, is it still a fatty pad?
It's a combination of losing the fat under the eyelid. So you're losing volume as you age. So we can, we can fill that in naturally. So it looks very nice. Basically, this is a specific syringe. It comes like this, and you inject it directly into the areas that you need to treat.
It's got a tiny needle.
Yeah, the needle is very small. I mean, we have to.
Is it like an insulin needle?
It is like an insulin needle. It's very small. So you don't need anesthesia. It's very, very tolerable. It's very effective, and the results are immediate. You see the before and after right away. So you're filling the volume. You get decreased lines, and some of the wrinkles that we treat with that also are done away
Is that
with.
one treatment, or do they come back several
It's
times?
typically one treatment. Depending on how much volume that you need, we can inject as much as you need at the same time. Now remember, this can be injected over and over again. It's very safe, and there's really no complications with it. So anywhere the patient needs to build volume, we can build the cheekbones, to make, it's almost called a liquid facelift. Instead of having to undergo the knife, you can inject this in areas that are...
And how long does it last?
This one in particular lasts 12 months. There's another brand that lasts 5 years, slightly more expensive, but that lasts 5 years.
Wow.
That just came out.
And what is that made out of?
That's made out of bovine albumin, collagen.
I know you have to be very careful who you go to for these things, though, because there are people
Yeah.
who've had things injected into them that are not good. So you have to make sure that you go to an MD to get this done.
Yeah, that's absolutely true. You have to take the precautions and use the approved injectables in the right way, in the right place, and not overdo them. You have to have the experience in doing them and know where to inject and where not to inject. For example, Juvederm is very safe for the lips, and this product is not good for the lips. So if you want bigger lips, you can use Juvederm as an injectable there.
What would this do to the lips differently?
This can cause some nodules and a little bit of hardness that you don't want in your lips.
Because I know we've all heard the horror story about some of the celebrities where they've had things injected into them by non-doctors that are things that should have been put in cars.
Yeah, that's unfortunate. Yeah, that's true. So you have to pick a physician or a clinic that is reputable and very safe.
What have we missed here? You've got aesthetics and massage too.
Right. We also have aesthetics practice, which is facials. We do microdermabrasion for regular skin care. It's very good for acne as well. We also treat acne. We also have a massage therapist on site to take care of patients with back pain or other issues. It feels very relaxing, of course, with a massage. And going back to the laser, we missed a few things on the laser. Acne treatments with the laser are very effective. I know a lot of young people struggle with acne as soon as they're in high school or they get older in their later teenage years. But acne can be treated with this laser, which actually targets the acne bacteria and kills it with the laser. There's a specific wavelength targeting the acne bacteria. That's a very effective treatment. And we also had the skin tight procedure, which is, of course, besides the injectables that can take care of some of your wrinkles, skin tight procedure, which we just mentioned, was also a laser procedure.
Do you put a gel on?
Yeah, we use ultrasound gel to transmit the laser light into the skin.
It's interesting about acne because have they ever really found, are there several causes for acne? And do you give medication also with it or not?
We try medication initially, but oftentimes medication is not enough. So you need to do something in addition to the medication. So we need to combine it with the medication along with the laser light treatments. And also, you know, if there's early mild acne, we can treat it with microdermabrasion.
You know, I never experienced acne as a teenager or anything,
Yeah.
and only one time did I ever get a breakout even ever on my face, and it was just horrible. And I feel really sorry for people who have that because it's a horrible feeling.
Yeah, unfortunately, it is very, very, sometimes can be very disfiguring to a face. You should take care of it before it causes scarring, because acne scarring can be...
I was going to ask you about that.
Yeah.
Now, do you do something about that when people have acne scarring?
Yeah, we also have treatment for acne scarring or other scars. I mean, if you have other scars, there's a very effective treatment called profractional. It's built into the laser as one of the treatments. It basically makes little tiny holes into the skin where the area of the scar is, and it revises the scar, which means that it decreases the scar appearance, it improves collagen growth in that area, and it fills in the depressions, or if there's some raised areas that they'll go down.
Will it work on keloids?
Unfortunately, keloids are a different animal. Keloids are treated either with injectable steroids or possibly resections if that's feasibility. Keloids are hard to treat with laser themselves.
Now, that's another thing. Will keloids be formed from any of these kind of treatments?
Not typically, no.
Okay.
Keloids are, some people are prone to form keloids on their own with even minor injuries, but we take a full assessment before we treat anybody with any more of these
Because somebody had told me that even if you form keloids on other parts of your body, that you won't form them on your face.
No, I've had patients, I'm treating a patient now with large keloids in the earlobe, and she had it resected. Unfortunately, it came back, and it's harder to treat it the second time around after it comes back.
How did she get it in the first place? Did she have surgery?
She had a ear ring.
An earring?
Yeah, earring that started it. So some people are more prone to having keloids. But in terms of the acne, going back to the acne scarring, you can do this profractional procedure to revise the scars, and also to do a combination of skin tightening. Some people have smoker's lines on the lips, upper lip. That's a very good treatment.
Those little tiny lines?
Yeah, those little tiny
yeah.
up and down lines. That's treated with profractional, combined with another procedure called micro laser peel, which ablates. It's an ablative procedure, which means we ablate a little tiny surface layer of the skin. We take the laser, put a setting on it on the dial, and sometimes we have to numb the skin because sometimes it can cause a little bit of stinging. And we give you a newer skin. The recovery time for that is like a day, or sometimes it can be more, depending on how deep you go. But it's very effective, very comparable, and better than chemical peels, which we also do. So mild chemical peels are a first step, sometimes for acne treatment as well. And then you can do the micro laser peel.
Can you do laser resurfacing underneath the eyes?
Absolutely, yes.
Yeah.
We have a specific technique for laser resurfacing under the eyes. We have to protect the eyes with internal shields, which we put on top of the eyelid, so make sure that we don't harm your eyes. And then you do the profractional procedure, and along with the micro laser peel under the eyelids.
And what about the upper eyes? You mentioned that too. You can do something about skin tightening there too? The
upper eyes, you combine all these modalities together too. It's not one or the other. Sometimes you need a bunch of things together. Depending on what you need, you can end up getting a combination of fillers. You can get a combination with the combination of laser procedures such as profractional and micro laser peel. And also, sometimes you need the Botox to take care of some of the wrinkles that are over the forehead.
Do you still use Botox a lot?
Botox is very effective, yes. Botox is actually a very interesting, if you want to call it a medication. It's very effective for frown lines over the forehead. Also the 11 lines when you frown over here, over the forehead.
Because it paralyzes it?
Yes. I mean, it actually stops that movement of the muscles that cause that line. And if you keep repeating that movement over and over, and sometimes done unconsciously.
So basically we should never smile in our lives, and then we wouldn't have any wrinkles?
No, I would always encourage you to smile.
No, but I mean, is that what does it? Is the movement?
Yeah,
of the
the
face?
movement Predator movement,
Yeah.
because if you keep smiling, these lines form, and you keep looking up like that, these lines form.
Or frowning.
Or frowning, yeah. And plus you lose the elasticity in the skin over time, so that as you grow older, the movement causes grooves in the skin. So if you can, if it in the right hands, Botox can, decrease those lines.
Now, some people, as they get older, get those really, really deep furrows in their. Can that be fixed too, or no?
Yeah, we can dial the depth of the treatment on the profractional procedure. So anything that's even deep can be helped with the profractional procedure.
Be a nice present for Valentine's Day.
Absolutely.
Okay, we only have about 3 minutes left, so what have I not asked you that you'd like people to know about, Dr. Safvi?
Oh, sure. We're a full-service vein and liposuction center, cosmetic center with massage services and aesthetic services. Also, is fully staffed with medical doctors, myself. We have several other physicians on site. That if you have any other concerns with vein disease, which is our primary focus, you can come in for consultation by just calling a number. There's no, it's a complimentary consultation.
That's for the veins or for all these things?
All these things.
All these things you
Yeah.
can come in for a complimentary
Yeah.
consult. You can't beat that. And I will tell you, like I said, I had that problem one day with just a pain in my leg, and I had just done a show on deep vein thrombosis with several young men who have had deep vein thrombosis, which I'm really surprised because I don't think we used to see that, but we're seeing a lot of it in younger people now. So I immediately called your office, and Kathy and the other lady, who are very, very nice, said, well, come in and do this test. So I got to go through the test, and it's really not a problem at all to have it done. And you can find out these things easily.
Yeah, I'd just like to mention the vein disease. It is covered by insurance. Most insurances, even Medicare, covers the vein disease if it's the right type of vein disease.
Well, that's important because people who are on Medicare, and so you do take Medicare, not for these facial things, but for the vein.
For the veins,
vein
yes.
disease.
Yes.
Okay. So if you're interested in getting a brochure from the Advanced Vein Treatment and Cosmetic Center, you can email me. At the end of the show, you're going to get the information. This is Dr. Safvi, and he is, you pronounce it.
Safvi.
Okay, spell it.
S-A-F-V-I.
Right, so it's easy to remember then. And it's the Advanced Vein Treatment Center, and they're all over the Chicagoland area. Again, you can email me at asktvnurse@yahoo.com if you're interested in it, and make an appointment and go in for a complimentary consultation and get a brochure, and you can't beat that. So thank you so much for joining us.
Thank you so much, Karen.
And I do want to give you the phone number there. It's 866-325-VEIN, V-E-I-N. Thank you for joining us. We'll see you next time.